The EMDR is a psychotherapy treatment that was originally designed to alleviate the distress associated with traumatic memories. The EMDR therapy is an integrative psychotherapy approach that has been extensively researched and proven effective for the treatment of trauma. And how does this therapy work? When a person is upset, their brain cannot process information as it does ordinarily. Trauma may feel as bad as going through it the first time because the images, sounds, smells, and feelings haven't changed. Such memories have a lasting negative effect that interferes with the way a person sees the world and the way they relate to other people. EMDR has a direct effect on the way that the brain processes information. Following a successful EMDR session, the patients will still remember what happened, but it is definitely less upsetting. Numerous control studies show that EMDR produces more improvements than the absence of the treatment, at least for alleviating the symptoms of PTSD, such as those triggered by rape. Most studies indicate that EMDR produces more improvement than when the therapists just listen to a client's problem but do not attempt to intervene directly. As a conclusion, EMDR alleviates symptoms of traumatic anxiety better than doing nothing and probably better than talking to a supportive listener. But there's no evidence that shows EMDR is superior to exposure-based treatments as behavior and cognitive behavior therapies. An important term related to the therapy is REM, because EMDR's goal is to alleviate the distress that's associated with the traumatic memories, and that's also lots of other therapies approach. But EMDR appears to be similar to what occurs naturally during dreaming of REM, rapid eye movement, sleep. Therefore, EMDR can be brought up as a sociological based therapy that helps a person see disturbing material in a new and less distressing way. Scientific research has established EMDR as effective for post-traumatic stress disorder. However, therapies have since extended this treatment to a host of other conditions, including depression, sexual dysfunction, schizophrenia, eating disorders, and even the psychological distress generated by cancer. One important term related to this therapy is REM. EMDR's goal is to alleviate the distress that's associated with the traumatic memories, and there's also lots of other therapies approach. But EMDR appears to be similar to what occurs naturally during dreaming of REM sleep. Therefore, EMDR can be thought of as sociological-based therapy that helps a person see disturbing material in a new and less distressing way. More than 30 positive control outcome studies have been done on EMDR therapy. Some of the studies show that 84 to 90% of single trauma victims no longer have post-traumatic stress disorder after only 3 of 90-minute sessions. Another study found that 100% of the single trauma victims and 77% of multiple trauma victims no longer were diagnosed with PTSD after only 6 of 15-minute sessions. In another study, 77% of combat veterans were free of PTSD in 12 sessions. There has been so much research on EMDR therapy that is now recognized as an effective form of treatment for trauma and other disturbing experiences. Over 10,000 clinicians throughout the world use the therapy. Millions of people have been treated successfully over the past 25 years. Some EMDR proponents have called it a miracle cure and paradigm shift, and some proclaim it an exciting breakthrough in the treatment of anxiety. But in fact, EMDR is a treatment method, but it does not have a magical effect as it may sound like. For resources, I like to share this website with you. The EMDR International Association is a professional association where EMDR therapy practitioners and EMDR therapy researchers seek the highest standard for the clinical use of EMDR. This website provides information to the greater EMDR community, including clinicians, researchers, and the public that our members serve. Fun fact. One day in 1987, Francine Shapiro, a California psychologist in private practice, went for a walk in the woods. She had been preoccupied with a host of disturbing thoughts, yet she discovered that her anxiety lifted after moving her eyes back and forth while observing her surroundings. Intrigued, Shapiro tried out variants of this procedure with her clients and found that they too felt better. That's why EMDR was born.